Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a consultant talking to a woman whose father has just been admitted to hospital. Now read the question.
So we've talked about the various things that might have caused your father to collapse. A lot of times we investigate multiple symptoms so as to rule out any life-threatening conditions.
So it could take some time to get to the bottom of the problem?
Possibly. In the meantime, he's quite stable now, and we're encouraged by the progress that he's making.
Well, I'm glad to hear that. But at least he's not in any great discomfort, is he?
According to the assessment at the bedside by his nurse, his pain is well controlled, and we'll try to keep his sedation at an adequate level until we're ready to begin treatment.
Question 26. You hear a trainee nurse receiving feedback from her tutor about the ward round she's just completed. Now read the question.
How do you feel your ward round went with that patient?
Oh, I really should have told him what I was about to do, rather than just rolling up his sleeve to take his blood pressure.
Yeah, it would have been preferable, but at least you realise.
Thanks.
I think you did your observations really well, though. You checked the patient's details are correct, you put the date in, you timed it correctly, you observed that all your parameters are within normal range, and you did the respiratory rate while you were doing your manual pulse.
Yes, the pulse was quite strong and regular.
And you could have passed that on to reassure the patient too. But you look back at the previous observations, put your signature at the bottom. That's all good.
Thanks, okay.
Question 27. You hear a hospital nurse briefing a colleague about a patient with chronic obstructive pulmonary disease, or COPD. Now read the question.
So who's next?
The patient in bed 12, she had a fall at home about a month ago, but she's otherwise independent with her day-to-day activities. Her falls risk is high given her recent history. She's been assessed by the physio, and she's on a rollator frame to ambulate. Her skin integrity is intact, and she's responded well to all treatment.
Good.
She's on a normal diet. The observations were last done at 6 a.m., and they were stable. Her medications are IV tazocin due at 2 p.m. and prednisone next due at 8 a.m. tomorrow.
Okay.
You need to check with the doctors today whether she'll continue with the IV antibiotics and whether the cannula can be removed. At this stage, they're aiming for discharge in a couple of days' time, pending discharge from the physio and also ceasing IV antibiotics.
Okay, thanks.
Question 28. You hear 2 hospital managers talking about a training session for people who do voluntary work with patients. Now read the question.
So how do you think the volunteer training course went?
Well, we had a reasonable turnout, considering that these people already give up their free time to drive patients to appointments, visit inpatients, all sorts of stuff like that. It's quite a lot to ask. It's a wonder so many managed to fit in the training too.
And they did seem to get something out of it, if the feedback sheets are anything to go by. From my point of view, though, I just wasn't sure whether it went into issues like customer care, confidentiality, that kind of thing, in enough depth.
Well, that's something we can always look into before we roll out any more.
Well, I think we should.
Question 29. You hear a pharmacist talking to a doctor about a patient's medication. Now read the question.
Sorry to bother you, Dr. Baker. I just wanted a quick word about Mrs. Milton's prescription, the one for anti-inflammatories that you gave her after last week's consultation.
Oh, yes, for her osteoarthritis.
Yes, so she's been on them for a week now, 500 milligrams twice daily. The thing is, she's just been into the pharmacy complaining of a headache ever since she started the medication.
Really? Well, that does happen in some patients, but maybe switching her onto a different anti-inflammatory wouldn't be a bad idea.
OK, I'll look into some options and then run them past you later, shall I?
Fine, thanks.
Question 30. You hear a surgeon talking to a member of his team as they are finishing a surgical procedure. Now read the question.
Good, there's no more bleeding. The procedure's finished.
Can we just do the sign-out? How much contrast did we use?
That was 120 mils of Omnipaque, and we did reach a high dose, so I'll have to fill out a high-dose form. I'll do that afterwards. The other thing was that the ultrasound machine was giving us a few problems.
Yeah, I'll have to get the technician on the phone.
Do it now, though, because we'll need it if we're going to get through all our lists today.
Do we need to send this patient up to HDU?
Actually, everything was quite straightforward, so I'd say a regular ward bed is fine.
That is the end of Part B. Now look at Part C.